Good afternoon. Thanks for joining us across the fence. I'm Fran Stoddard. We know that a healthy lifestyle is a good idea, but what does it really mean, and how do we begin to make better choices around food and exercise? Rise Vermont is an organization that's made a difference for folks in Franklin and Grand Isle counties and is now the program that is going statewide to help address serious health issues like obesity, diabetes, and heart disease. Most importantly, they make it fun and easy to make healthy choices. Rise Vermont Executive Director Marissa Parisi is joining me today to share how and why communities are getting on board to help all of us live healthier lives. Welcome, Marissa. It's great to have you here.
Thanks, Fran. I'm happy to be here.
So tell us a little bit about what Rise Vermont is and how it got started.
Sure. So Rise Vermont got started in 2015 in Franklin and Grand Isle counties as a project of Northwestern Medical Center because I'm sure many of your listeners can relate to this, that only about 20% of your overall health is related to access to health care. The other 80% is about the environment where you live. Do you have access to healthy food, to recreation opportunities? Do you live in a safe community? Do you live in a community without pollution or other irritants? All of those things connect into your broader health. So Northwestern Medical Center in 2015 deployed a team out into the communities to work on these things, and it went so well that starting in 2018, One Care Vermont, which is the state's accountable care organization that has a membership of hospitals across the state as well as health centers, said, let's bring this model statewide. So our team started in January of 2018 at One Care to help bring the model to other communities across Vermont.
Fantastic. And how is that going, that expanding that reach out from one or two counties to the whole state?
It's gone very well. We've had especially a lot of very willing hospitals to work with us to add Rise Vermont program managers who are team members of ours statewide, who work within our evidence-based model of going out into communities, working right hand in hand with communities to make, whether it's changes to built environments like adding sidewalks or playgrounds or opportunities for recreation, to creating other neat programs through our granting program. So right now we started with one hospital, Northwestern Medical Center, starting in 2015. Since 2018, we've added 9 more hospitals, and we'll add Rutland Regional Medical Center in January, plus hopefully Northern Counties Healthcare, which is the federally qualified health center up in the Northeast Kingdom, early next year as well.
So when you go into a community, what does the model look like? It's different in every community, I would imagine. Every community is different.
It is, and that really matters to us. It really depends on the community. So we place these program managers who have incredible skill sets. Some of our program managers have owned gyms in the past. Some are experts in nutrition. They have a really broad skill set, but what they do is they work with community leaders and people who know the communities in their hospital service area well, and they really identify focus areas and focus towns in those areas. And then the program managers work with the community to really first figure out what's going really well in those communities, because lots of us who live locally know it might be your library, it might be your recreation department, already doing really cool work, but could use some additional resources and support. So we really work to fund and give money out to those local organizations. And then wherever there may be gaps, our program managers with their expertise provide programming or support or work on policy. So programming might be working in a classroom, policy might be working to add those sidewalks.
Wow. Well, you put together a great little video that highlights what Rise Vermont is all about. So let's take a look.
Going to the doctor was a real eye-opener. I thought I was in good shape, but by letting my exercise and eating habits slip, I was putting myself at risk for heart disease, stroke, type 2 diabetes, even certain types of cancer. The good news was I could still make simple lifestyle changes instead of finding myself on a regimen of medication. I want to be around for my family for years to come, but I need help if I'm going to make myself exercise more and improve the way I eat. That's where Rise Vermont comes in and creates a culture of support for my desire to get healthy. One of the most impactful numbers on your health is your zip code. The average education, income, age, even home values around you, they all combine to impact your overall health. And that's why Rise Vermont wants to be part of where you live. They support public policy for adding more sidewalks, crosswalks, and walking paths. They help you find excuses to exercise by funding things like snowshoes at local libraries during the winter and providing access to healthy activities throughout the year. They build good habits for the next generation by making improvements at your schools that support active play and encourage healthy snacking, and they've helped me eat healthier too. I've even been inspired to get my coworkers thinking about their health, and the Rise Vermont team is helping me get the message out. And this summer, I organized my first group walk. My zip code may have stayed the same, but the rest of my numbers are looking much better. When we make these changes and stay healthier, that costs everyone a little less. It's just one more reason we should all work to rise together.
That's great. And Ben, who put that together, used his own story.
That's right. That's his personal story. He lives up in the St. Albans area and really made changes and saw the importance of how his environment would support his health.
Wow. And I love the way libraries can play a significant role, either, having equipment available or something. That's happening in communities, and it's happening here with Rise Vermont.
Yeah, it's happening statewide, and libraries are a great example of a terrific local partner. In some cases, our libraries have said, oh, we will be a CSA pickup for local communities, or things like Ben said in the video, snowshoes being available at libraries is an initiative we've worked on with the Vermont Department of Health, because you might enjoy trails in the summer in Vermont, but might not have the equipment to be active year round. So there's your library right there. You can check the snowshoes out like you're checking out your library books.
Right, and a CSA, of course, is community supported agriculture, getting that wonderful fresh food. How is it playing out now? How successful is it? I keep thinking of New Year's resolutions. We all say we're going to eat better, and then we don't. So how do you sustain this kind of healthy environment?
Great question, because what's so important is the day that maybe you're in your doctor's office and your doctor says you should maybe consider, working out or eating better, what are you going to do? You don't want to be alone. So if you can instead, send your child to school where they'll be getting healthy food, or go to your workplace and know that you have policies around how many birthday cakes come to the office, that can really support you making those choices so that you don't feel so alone. So the way that it's playing out in communities is really working on that needs assessment of what does the community need? What are they seeing as a real need for change? And in some cases, it's that you do need access on just a crosswalk to get from one busy side of town to another busy part of town, but that's where the grocery store is.
To encourage walking.
Exactly, to encourage walking and access to nutrition. So it's that type of assessment and work we're doing in every community.
Fantastic. Well, I'd like to show you've got some really great videos, and I chose these two. The other one is looking at Swanton's town manager, Reg Beliveau, who talks about how this is working in his community.
Yeah.
Let's take a look.
I had 5 employees that were getting really close to retirement, and one of the things I wanted to make sure happened was that they could be healthy. It was important to have pre-screenings, prevention rather than having to go into the hospital because, hey, I don't feel good. Well, a lot of our pre-screenings had gone away because of the expense of healthcare. Rise Vermont was looking at municipalities and said, hey, we have this program where we had free health screening. We would like to know if you'd be interested in it. And it was pretty much a yeah, very interested in it. 3 employees were identified as having underlying issues that they didn't know they had. I think there was 4 employees that were smokers, and now only 1 still smokes. One had found out there was a lot of underlying health issues that he had. He's lost a lot of weight. One of the concerns that we had for having healthy children, the obesity rate in our elementary schools, was walkability to the school. As you can probably hear, there's a lot of traffic in this area. So adding bike lanes, adding crosswalks, and just getting these grants to get these flashing crosswalk notifications, more proof that we're serious about making this community walkable. The more you walk, the healthier you are. Practice what you preach. I had lost 40 pounds. This summer I put 20 of them back on, but still 40 pounds is a big deal. We've seen more of a focus on preventative health, through the screening. We've got an employee's garden now that we have right at the complex. I've seen a lot of people enjoy is just walking through Swanton. So there's a lot of moving parts that Rise Vermont helped with, and I think within our employees, I guess I just wanted them to know that the village cared about them, not just as an employee, but as a person. And just wanted them to be healthy. And this was a great program, Rise Vermont, to help with that. My name is Reg Beliveau, and I rise for the employees of Swanton and the community of Swanton.
So inspiring that, he got his employees and clearly the town to get involved in walking, and because he realized that chronic disease costs a lot of money. and that, you know what, 4 or 5 people quit smoking, and he lost all that, which just, it really is a pretty amazing story.
Yeah, for sure. And our team in Franklin and Grand Isle, what they did was really, talk to Reg about what he wanted for his employees. And you could hear in that video, he wanted them to really not only take care of Swanton, but take care of themselves. And that's what we're looking to be helpful with.
Fantastic. Well, another statewide campaign that you just started and are currently working on to change behavior and improve healthy outcomes is the Sweet Enough campaign. So tell us a little bit about that, what you're trying to do.
Well, sure. One of the areas that I think a lot of people don't realize is how much sugar is in your beverage. And on average, Americans are drinking 3 to 6 times more sugar in their beverages than they really should be drinking. And I think a lot of people think of Vermont as very healthy, but we did independent research in Vermont, and we showed that that's actually going on in Vermont as well. So we've created a campaign called Sweet Enough, like you're sweet enough, your home is sweet enough, your life is sweet enough, without the added sugar, and offering alternatives to beverages you might be drinking with a lot of sugar that you may enjoy just as much, but have better health benefits.
Right. Fantastic. So you're targeting women and men and children, and it's fantastic. And you might even see a label on a cooler at your Quick Stop. Yeah,
so one of the things I think is an unexpected partnership is we are working with the beverage industry on labeling beverages that are available, like you said, Fran, at Quick Stop or in your in a local store near us in Colchester, near our office. There's a pizza, a pizza shop that has this cooler, but it's merchandised with just beverages that have no sugar in them or very, very low sugar, so that when you go to that cooler and you see a Sweet Enough logo, everything in there is safe for you to take, and it's all low sugar. So we made the choice easy.
So how can people get involved with Rise Vermont?
So you can always go to our website, risevt.org. And there you'll see all the counties. There's county-specific information, so you can check there.
Fantastic. Or the phone, was up there, 847-9623. Thank you so much for joining us across the fence. Thank you, Marissa Parisi of Rise VT. Thank you.